My name's Kevin Rogers. I'm superintendent of Lewisville ISD. I'm on my feet a lot, attending events, going to schools, visiting teachers' classrooms, so on. For the last 7 to 8 years, my knee was always painful, swollen, had developed a limp, and so it was starting to hurt my hip. I knew it was about time.
After hearing his story and taking a look at his x-rays and doing a complete physical exam, we decided that he would be an excellent candidate for knee replacement surgery. So what that involves is actually making an incision, making special cuts in the bone, taking out the arthritic portions of his bone, and replacing it with an artificial knee, which is typically made of metal and plastic.
After a total knee replacement, it's really important to go through physical therapy. So that requires immediate physical therapy while you're in the hospital, and then outpatient physical therapy, which is what he's been going through over the past couple weeks and months. Starting from something as simple as a quad set, just trying to tighten up that muscle on the front of your thigh, all the way to squats and weighted squats and things like that.
I've been very fortunate. I chose to attend outpatient rehab at Medical City Lewisville, and those folks are just great. I've been around for 34 years in Lewisville ISD, and I've walked a lot of classrooms. I really feel great that my new knee is allowing me to be pain-free.